Hello people, in case you didn't know, January is Cervical Cancer Awareness Month, and in this video I'm going to be discussing with you everything you need to know about cervical cancer and how you can protect yourself from it. Well, as we all know, cancer can develop in any part of the body, but when it develops in the cervix, which is the entrance of the uterus from the vagina, it is called, in common parlance, the mouth of the uterus is when it is called cervical cancer. Why is cervical cancer important? Well, it is the first most common cancer in women globally, and in our country, Nigeria, cervical cancer is the third most common cancer and the second most frequent case of cancer death among women aged 15 to 44. So it is very important that we know about cervical cancer and how we can protect ourselves from it. So what is the cause of cervical cancer? Well, it is said that 99% of cervical cancer cases are as a result of infection with the high-risk type of human papillomavirus. Human papillomavirus is the most common sexually transmitted infection in the world, and it is said that 80% of people who are sexually active will have had HPV at one time or the other in their lives. Now, HPV, as far as it is, has many subtypes, and like I said, the high-risk type is what causes cervical cancer, and the low-risk type also causes genital warts. So HPV is not just responsible for cervical cancer, it also causes anal cancer, penile cancer, oropharyngeal cancer. In short, it is a terrible virus, right? But most people, when they come in contact with HPV, their bodies are able to clear it within 1 or 2 years. But for those that are not able to clear it and they have persistent infection with HPV, that's when it causes problems like genital warts or cancer. So if you have persistent infection with the low-risk type, you have genital warts. If you have persistent infection with the high-risk type, you have cervical cancer. The interesting thing about cervical cancer is that even when you have persistent infection with the high-risk type of HPV that causes the cancer, it can take up to 15 to 20 years for the cancer to develop, right? But in some women that have HIV, the cancer can develop faster. This is why early detection is key. Now, let's go to how you can protect yourself from cervical cancer. Cervical cancer is, like I said, caused by HPV, and luckily for us, there is a vaccine for HPV, yes, right? In Nigeria now, if you have a girl child aged 9 to 14, please take them to the health center closest to you to get them vaccinated. It is just a single dose of vaccine, and it is highly efficacious in protecting them against cervical cancer. Well, you say that I am older than 14 and I still want to can I still get vaccinated? Yes, you can. For women up to the age of 26, you can get vaccinated. Although the age between 9 to 14, where we say that young children should get vaccinated, is that we assume that they've not had any sexual contact and they don't have HPV at all. But if you're up to 26, you can still get vaccinated, even up to age 44. But for women 27 to 44, speak with your doctor. But if you're less than 26, you can still go and get vaccinated, only that it is not free once you're over 14. You can walk into any tertiary hospital to get vaccinated, or there are also private facilities that offer the services, right? But if you're 27 and above, please discuss with your doctor whether or not you should get vaccinated. And please note that if you've had HPV infection before you get vaccinated, the vaccine will not take away the previous HPV infection, but it would, prevent infection with all the subtypes of HPV that the vaccine fights against. Now, the other part of cervical cancer prevention is to go get screened. Yes, ladies, please. Early detection saves lives. If you're above 21, you can get your pap smear done, and you only have to do it every 3 years, right? And once you are above 30, you can also get your HPV screening done. I'll be making another video to explain exactly what pap smear and HPV screening is, the difference between both, and how often you need to get this test done as a woman. Thank you for watching this video, and see you in the next one.